That's good. Good evening, everyone. How are you guys doing this evening? Good. This weather's glorious, huh? The cold is soon to be gone and the warmth is near. How many of you guys like winter? Oh, boo. What's your favorite winter hobby? Shoveling snow. Well, I want to, yeah? I like the snowblower. It gives me some time and peace, so I understand. Like she said, my name is Dr. Nicholas Pratt, and it's a pleasure of being here this evening. My job tonight is a couple things. Number one, it is to help you guys gain a higher level of awareness of your health. Okay? How many of you guys, by show of hands, want to improve your quality or level of health this year just by show of hands? Okay. So a couple things. In order for that to happen, in order for us to actively improve our state or quality of health, what I need to accomplish tonight is one thing. It's called a tipping point. Okay? That's where the information that we discuss when we go over this evening is you guys start to engage and apply that to your life, so when you leave here, that leads to new conscious action steps. Okay? If we don't apply...
Right, you know all those times your mom...
If we don't apply our level of health, if we don't apply these action steps, we physically can't expect our health to improve. And so what I want to do is I want to create this level of tipping point here so that we can get you from a state of awareness into action. Like when we talk to teachers, it's getting you from a state of education into engagement, right? We know that information, is powerful, but it's the application of that information that truly changes lives. And so today what I want to do is I want to challenge you guys on your health, okay? Now the only time that we're challenged on our health is when? When we're sick, when we've lost it. Right? And in that moment of crisis or that situation, we tend to make our decisions out of fear and out of anger, right? It becomes a reactionary position, a reactionary mindset. What I want to do today is I want to encourage you guys to be more proactive, preventative, preemptive, okay? Because research shows that a lot of the health situation conditions that we deal with today can be prevented with the proper lifestyle decisions. It's not always the things that we do to ourselves. Sometimes it's the things that we don't do. Okay? So, and I'm not sure why the PowerPoint slides are continually siphoning at a 60-second clip. But anyways, okay, I want to engage you guys tonight with your health. I want to challenge you guys with your health. And what we're going to talk tonight is about text neck. Okay? You guys have ever heard that terminology before? Okay? The problem is not new, but the terminology is. And so I want to give you guys a short couple-minute video and just to explain to you guys a little bit about what it is, and we'll get into the meat and potatoes of that tonight. And I want to check one thing on the PowerPoint just to ensure that these 60-second transitions are not occurring throughout the remainder of the slides, because that would be bad. Transitions. Okay, we should be good to go. And here's the video.
Right, you know all those times your mom told you to stand up straight, you're standing like a caveman. Well, you learned your lesson and stood up straight, but guess what? We're going back to caveman. Why? Your smartphone. Dr. Alex Vidan is chiropractor from Vidan Family Chiropractic to talk about this thing. It's a real thing called the cervical curve. Good morning to you, Doc.
Good morning.
So where our heads are kind of leaning over, and you brought a weight to kind of demonstrate.
To demonstrate. So essentially what's happening is, if we say that our head is 10 to 12 pounds, 15 pounds, normally if we're here with the curve, it's not a problem. But as we start leaning forward more and more, like you were saying, to look down at our devices, it starts to put more stress and strain on the system, on the cervical curve, and starts to cause problems.
And you're seeing a lot of this in your office, right? All right, let's go to the x-rays. We have this shot here, but then we'll show that afterwards. Let's go to the x-rays in our monitor right now, before and after of somebody with cervical curve. And you are blaming this on smartphone use.
Yeah, absolutely. We're starting to see more of that text. So when we're looking here, this is before care started. And we've got a straight spine, we've got pressure going forward, we've got pressure to get put more on the bone and on the disc. It's not meant there, it's actually meant back here. So what we want to see is we want to see this curve that gets instated. When we have this curve, it starts to allow more proper function, decreasing things like headaches, migraine, sinus, allergy, heart, lung.
All of those things can come up from doing this all day, right?
Exactly.
So what are the recommendations for our smartphone use? How much would you recommend?
So it's hard to say, look, we're not going to stop using our smartphones.
No, we're not.
It's not going to happen. So what we're saying is this. Let's take a mobile moment to just look up. So there's a campaign that's Look Up America. And so in that, we want to just take a moment to look up and go into extension.
Is it so that
do this
you're
all day.
extending this here?
Going back.
And what about kind of rolling and doing all that as
that
a
movement. And so what we find is we find that a lot of times patients come in like this with these problems in their neck. And then what we need to do is we need to make those changes through chiropractic care and then using something like this.
Okay, let's go back to that other photo now. So you basically said after the care of the cervical curve, you can do, and this is not something you sleep on, you kind of referred to it as sort of a retainer for your neck.
It's like a retainer for your neck. So after you've seen your chiropractor and they're doing what they do to restore the curve, a gentleman named Dr. Deed Harrison with CBP, he's come up with this, and there's research to support the findings that after using this, after you get chiropractic care, that you retain that curve that should be there. And so even long after, even a year later, we start to see that that curve still stays the way that it should be, as opposed to when we don't do that, it doesn't do it. So we want to use that retainer-like device.
So if you're having headaches, reduced range of motion, weakness in the arms or leg, loss of grip, difficulty walking, all this stuff can be attributed to you looking at your smartphone. So look up, America.
Look up, America.
Just look up, take a couple of moments and do that, and you'll start feeling better.
There you go.
Hopefully, if not, give Dr. Vidana a call. We've got a link to his website.
Dr. Vidana is actually a close friend of mine. Both of us perform a technique in our office called chiropractic biophysics, okay? Meaning that there's a structure, there's a certain anatomy, anatomical position our body is supposed to be in order for our body to function at its normal level. And so Dr. Deed Harrison, he was talking about him very briefly. He was holding what's called a Denner roll in his hand. That's a piece of equipment we have in our office to help patients improve their state of health through spinal position. But the problem is this thing called text neck, right? And that's what I want to discuss with you guys today, is text neck is not a new problem at all, okay? It's just a different word for the same condition that many people have been dealing with for years, okay? And so I want to ask you guys, what do you guys feel text neck is? What is text neck to you? Bad posture. So specifically, what position do you think of when you think of text neck? The head forward, the shoulders rounded, tight anterior chest and neck muscles. Okay, putting your body in a state of position like this. Okay, how many of you guys see people walking around like this a lot? Okay, is that something that was brought upon only by this guy? No, it's been there for years. But the problem is the prevalence of this condition is increasing with the usage of these guys. Okay, unfortunately, we wish that it was from reading more of these. Journal articles, research studies, books, education. But now it's Snapchat, Twitter, Facebook, right? And so what I want to do today is I want to inform you guys, educate you guys on two things: the importance of structure and the importance of function. If you can have a proper level of structure in your body, meaning we have a normal anatomical position, our body's in the right postural alignment, okay, and we retain our joint biomechanics, which we're going to simplify as functionality. Our body is moving the way it's supposed to its full capabilities. When those things are intact, your body can truly optimally function at its normal levels. If my body was functioning at 100%, how much pain and stiffness and achiness would I have? None. Okay? If my body's functioning at its optimal level, which is 100%, how much sickness would I have? None. How much organ problem or arthritis would I have? None. Okay? Now, I don't make empty claims. And this is where I want to bring in some research here, because the reality is structure and function play a vital role in your level of health. So I want to go over a couple things here. Structure and function. Forward head posture. Okay, we're going to skip forward a little bit here, and we're going to go backwards as we go through. But forward head posture is a major issue today. Okay, and when we look at forward head posture, it's where that head moves in front of the shoulders, like, I think I skipped it. Here we go. It moves in front of the shoulders like this. So the X-ray on the left is a picture of the neck. Okay, if I were facing just like so, we could see that the teeth are going to be in front, the back of the skull. There's 7 bones in your neck that need to have a 42-degree tangent arc. Okay? The head has to be right on top of the shoulders. The bones themselves need to be nice and square. Okay? The disc spaces between the bones need to be big, nice, and even. Now, the problem is, after we have some stress, some injuries, repetitive actions in our life, doing the same things all the time, okay? Or if we have some car accidents, sporting injuries, slips, falls, our body will get to the point to where we're at a phase 1 level of degeneration. Okay? This is a degenerative chart. Okay? And so what happened to the neck in this position? It's gone forward. We're losing the curve. So a terminology that I want you guys to understand tonight, which is probably not new, it's called forward head posture. So where that head moves in front of the shoulders like this. Okay? That's the foundation of what's called text neck. Okay? It's the anterior head carriage. The head moving in front of the shoulders like this. And so I want to do a little demonstration to you guys. Okay? So I want you guys just to relax, just sit up nice and tall, take a couple of deep breaths in. Okay? And notice how easy it is to breathe. Right? A couple deep inhalations and exhalations. Then I want you to do this. I want you to stick your head out as far as you can. I want you to try to breathe in really deep. Is it hard? Is it easier? Does it change? It's much more difficult. So we notice an immediate impact on our respiratory function, our ability to take in air. How on God's green earth is it possible that we could have an effect on our lungs from our head just sticking out in front like this? How is that physically possible? The reality is our body runs off of what's called the central nervous system. Okay? Our entire body functions off of one system primarily. That's the brain controls everything, has all the power in there that controls and functions every single aspect of your body, from the heart to beat, lungs to breathe, stomach to digest food, for you to express love, have communication, relationships, to eat, to move your little pinky toe. Everything functions off of that brain signal going down the spinal cord, then transmitting over the nerves, and then it gets sent to every aspect of your body. And when that part of your body receives the signal, we have an action. Okay? When the brain's able to send its signals to the part of the body that it needs to get it to, and that communication pathway is 100% functional, we have a functioning, healthy body. But forward head posture will interfere with your brain's capacity to send quality signals throughout the body. So here's what's interesting. Okay? International Journal of Spinal Physical Therapy, ISPT journal. Cervical genic headache. Some of you guys have ever had a headache before. Okay? Tight neck muscles back here, so on and so forth. Cervical genic headaches, an evidence-led approach to clinical management. So how can we get rid of these stinking headaches? What they found is there's a direct correlation with the increased level of forward head posture leading to an increased prevalence of cervical genic headaches. 100% linear. The more far forward you have forward head posture, the increase in frequency of cervical genic headaches. Okay, forward head posture and neck mobility in chronic tension type headaches. A blinded control study. What they found here is the same relationship. There's a linear correlation between increasing severity of forward head posture to the increasing prevalence of chronic tension type headaches. Okay, increased forward head posture and restricted cervical range of motion patients with carpal tunnel syndrome. How in the world could something out here be caused by something up here? What you guys are going to find out is the nerves, the brachial plexus is a subgroup of nerves that come out of your spinal cord in the base of the neck and the upper back. They come out of here, and then they go down to your arms, hands, and fingers. It's C7, medium nerve root. Okay? In this area where we typically feel the pain. And what they're finding out is this: increase in forward head posture, increasing prevalence of carpal tunnel syndrome. Respiratory dysfunction in chronic neck pain patients, linear correlation. Okay? Increase in forward head posture, decrease in respiratory muscle strength. The list goes on and on. Postural changes in women with chronic pelvic pain, hormonal issues, digestive problems, biomechanical influences on head posture and respiratory movement, sleep apnea. So what I'm saying is this: if we can control and improve the brain's ability to send its signals so that our body can function the way it's supposed to, we can experience a higher level of health. But it all comes from two things, structure and function. And so here's the reality. Anybody ever told by their mom or their grandma, okay, that's typically what it was for me, to sit up straight, shoulders level, points forward, all that type of stuff? Am I the only one that's crazy? Has anybody been told the importance of posture? Okay, so let's talk about posture for a second. What is normal posture? When you guys look at me from front to back, what should our posture be? Our spine should be straight up and down. Our hips should be level. The shoulders should be level. The head should be square on top of the shoulders looking straight ahead. Okay? That's what it should be like from front to back. From the side, when we look at you and take an x-ray from the side, here's what the body has to be like. The head has to be directly over top of the shoulders. Okay? The shoulders have to be over top of the femur heads, the hips, which have to be directly over top of the knees, over top of the ankles. We can't have any forward head posture or retracted head position. We can't have any anterior pelvic weighting or sway back posture. But then we have function. And I want to stick on structure for a little bit. So what happens here, if we're in this phase 1 position of the beginning of forward head posture, and if we don't fix it, what happens to that? It gets worse. So if we go back to the movie, the video with Dr. Vadan, and he's holding this 10-pound weight, he said, you know, we can hold a 10-pound weight directly over top of our elbow for a long time. Meaning when our head's directly over top of our shoulders, okay, we can have no muscle tension, no irritation. It's pretty easy. But the moment that we move away from our center of gravity, we start to stress tendons, cartilage, muscles, joint tissue, fascia, the joints themselves. Okay? The same thing happens with the spine. And so what happens is when we have that anterior head carriage, forward head posture, when we're developing that text neck position, and if we don't correct it, it gets worse. We get to a phase 2 position. This is a phase 2 level of degeneration. Now what happened to the disc spaces, the black spaces between the white square bones? They're thinner. So anybody know what that's called? Degenerative disc disease, spondylosis. Okay, it can lead to stenosis. Okay, and look at the bones. Over here in phase 1, they're still nice and square. But in phase 2, what happened to the bones themselves? They're irregular shaped. We have rough edges. We have osteophytes or bony claw-like finger projections are developing. That's osteoarthritis. Yes? Yes, absolutely. We will get to that. So here's the problem. Once you get to phase 2 of degeneration, that level of osteoarthritis, that level of disc degeneration, that's been progressing for 15 to 25 years. And if we don't fix phase 2, and then you get to phase 3, now we have more degeneration, we have more pain, we have more discomfort. Okay? It's hard to see maybe with the lights on, but you see the numbers on the bones here? You see where it says 5, 6, and 7? I ask you to try to find the disc spaces between those 3 bones. They're almost non-existent. If it's not corrected and stopped at this point in time, then we get to phase 4. Phase 4 is fusion. Okay? And at that stage of the game, we can't do anything to help you. Typically, at that stage of the game, we have intractable pain, pain that doesn't go away. We're dealing with multiple surgeries and a poor quality of life. Okay? And so when we see patients in the office, the first thing that we always want to check is structure. Is your body in the right position? Much like our car, right? We can drive a car if everything is in alignment, if everything is tuned up and square. How nice and enjoyable is that ride? It's peaceful. It's easy. It's smooth. But the moment we have that abnormal alignment, right? Our tires are off, or our alignment is off, or whatever is going haywire, things start to show up in problems. It's not just the wearing on the tread of the tires. we ignore that problem, it can cause much larger damage in our car. The same thing goes for our body. And so when we look here, this is what happens to our neck. This is the progression of text neck into stage 4 degeneration. You will lose the normal position by whatever means, and if we don't correct it or stop it, then it goes in the opposite direction. Once that happens, all the stress and pressure, it gets put directly over the square bones and disc spaces. It's not designed to carry it there. And so what happens is they start to degenerate, and then eventually they fuse together. Okay? The good news is that doesn't have to be you. The other good news is if you're in that position of somewhere between stage normal and stage 1 to stage 3, there's potentially a lot that can be done to help you. Okay? And so when we look here, this is a normal x-ray. Okay? We have a 43-degree curve. Everything is where it needs to be. And we have phase 3 degeneration. Okay? Now, typically the common thought, or sometimes we're even taught this too, that as we age, what happens to our level of degeneration? It follows us. The older we get, the more degeneration that we're going to have equates to a higher level of pain and a poorer quality of life. Okay? So if we were to go strictly off of that general consensus that the older we get, the more degeneration we have, which of these two patients would be older? Patient on the left or the patient on the right? Who should be older? The one on the right. Dean at 45 years old should be older. How old's Ann? She's the patient on the left. She's 84. How in the world can we have a person twice as old as Dean have no degeneration, no arthritis, no health care concern in the world, but an individual half her age has had 3 heart attacks, a stroke, is on 3 blood pressure, 2 cholesterol medications, and he's clinging for his life? It's because sometimes it's not just the things that we do for ourselves, but sometimes the things that we don't do. Okay? If we don't take care of ourselves, our body doesn't function very well. And so what I want to do is I want to go through some patients of ours that have given us permission to explain to you their case and show you the analysis that we go through and explain to you some of the treatment methods that they received so that you guys can understand the process that unfolds, that maybe help you in that condition if you're experiencing text neck. Matt, 25-year-old registered nurse, Mayo Clinic. Okay? I love situations like Matt. Okay? The reason why I love this situation so much, and I start off tonight with it, is because if you looked at him, you would assume that there's no care in the world and the guy is perfectly healthy. Okay? He's 25 years old, so should he be sick? No, he's got his entire life ahead of him. He's a registered nurse at Mayo Clinic. Okay, fantastic facility. He's educated, right, above the average person, so he's smart, so he knows more of what we need to do to be healthy. By the way, he's a marathon runner. He runs about 30-some miles a week, okay, which means he exercises. And exercise, is that good or bad for us? It's good, usually good, okay? On top of that, he watches what he eats, okay? Now, he's a vegan. Now, I'm not saying that veganism is the end-all, be-all of diet plans, because it's not, but it's a heck of a lot better than the standard American diet. Would you not agree with me? And so here's the reality. Health, right? Because we're here for one thing, and that's what can we do to improve our awareness of what health is so ultimately I can maybe improve. If we look at the common descriptors that most of us have when it comes to what is health, he's young, he's educated, he exercises, and he eats pretty good. So should he be healthy? Absolutely. But the reality is health is not based upon age, what you know or what you don't know. It's not even based upon what you eat all the time. It plays a role, but nutrition is not the defining factor solely by itself of whether you're healthy or sick. Neither is exercise. It's all about function. It's the brain's ability to communicate and relay messages to the body so that your stomach can digest the food that you're going to eat. If the brain can't tell your stomach to digest the food, What does it matter if you eat a Big Mac versus a salad? Your body can't digest the food. And so when we look at him, you would assume he's healthy. But the reality is he's experiencing extreme high levels of neck pain, radicular neuropathy in the arms and hands, and headaches. And so he went into his primary doctor. His primary doctor said, Matt, you shouldn't have anything. Why don't you come back in 6 weeks and maybe try these pain meds. If it doesn't work, we'll talk then. 6 weeks later, what happened to the pain? It got worse for him. So they came back in, they tried an off-label drug, a high-level potent steroid. That didn't take care of the problem for him. So then he was referred to PT. PT is a fantastic trade. It helps a lot of people. But the reality is for Matt, he didn't have a primary muscle problem. And so if his problem is not primarily muscular, does PT solve his problem? Not really. And so he came into our office referred in by another coworker, Ann. Ann's also on his Team Red Marathon team. Ann's a patient in our office and said, come on in. And so we came in and we took this x-ray. Now we had his x-rays from Mayo Clinic too. And if we look at this x-ray from the view of what a medical doctor would look at it, what does a medical doctor look for when they look at an x-ray? Does anybody know? Fractures, broken bones, right? Does he have any of those? No, he doesn't. Okay? Infections, tumors, cancers, pathologies. I'll just speed up the process. He doesn't have any of those either. Okay? So the x-ray report that came back from Mayo Clinic was non-conclusive. Everything's within normal limits. Then why does he have these problems? And so we look at things a little bit differently. Okay? When I look at it, we have to have a 42-degree arc in the neck. Scientifically proven. He's got a 30. He's lost almost 33% of that cervical curve. Is that a problem? Yes. Okay? We have no forward head posture, which is a good thing. We've lost the curve in the neck. But on top of that, those two numbers at the top, the 8 and the 14, those are different markers for different brainstem measurements. Those should both be at 18 degrees. They're short of that. And so this indicates to me that there is some issues that we might be able to particularly help with. Okay? But we need to go a little bit further because the symptoms that he's experiencing, I wouldn't generally see all the time with a spine that looks like this. This is not that bad in reality. Okay? It looks pretty close to normal. So we did what's called digital motion analysis. We took 2 more x-rays, one in flexion, one in an extension. And then what we did is we measured each joint's movement. How well did it move? Did C6, C7 move into flexion compared to where it was in a neutral position and into extension? And we did that all the way up and down. There's certain numbers that your body should move at every joint. And we did our homework. And so what we found out is that he had 7 subluxations. A subluxation is when the spine is either out of position and or the bones and joints are not moving to their full capacity. When that happens, you can have local pain, okay? Neck pain, upper back pain, shoulder pain. But what happens is if that subluxation is not corrected, wherever that nerve goes to that comes out of the spine to that level is going to start to become affected. If the nerves go to the base of the skull and wrap around to the head, from the head and the eyes, you're going to have headaches and migraines. If it goes down to your arms, hands, and fingers, you're going to have neuropathy, numbness, and tingling and pain in the arms and hands. And so we did that, and we found out that he had 7 subluxations. And on top of that, 2 of his 7 cervical spine bones weren't moving at all. Completely non-movable, fixated 100%, not even an ounce. Yes. You see the 2 big blue X's. You see one, I'm not very tall, right here. See my red mark? See those 2, that X there? And that X there? C3 and C6 didn't move forward, nor did they move backwards. And so what I did is I said, Matt, and I went through every level. These nerves here at C1, they go to this place and this place. Commonly we see these set of symptoms. C2 and 3, they go here and here and here. And he's like, wow, I can't believe it. This is exactly what I'm experiencing. And so what we had to do was we had to put a plan together to start to fix those subluxations. So we did just that. We started up by, yes?
On the picture on the left, you mentioned 14 degrees and 30 degrees. Which lines are you talking about?
Great question. So this 30.7 degree curve here out of 45, that's George's line at C2 and C7.
So yellow is what the center of his spine is. What's the red?
The red here, this is indicating his level of forward head posture. And so it's at sella turcica, which is just a landmark up here. And then we do a vertical gravity line down, and it should touch this front part of C5, which it does directly. If that line was in front of that bone, meaning if that line was over here, we could measure the amount of millimeters of anterior head carriage or forward head posture. And then from there, we can conclude how much additional real live apparent weight is the head in relationship to what it should be.
So is the yellow line supposed to go over to the red line?
No. It's just he has a shallow curve. And so this yellow line here should be more like this. Okay? And so the upper part of his spine should be tilted back more. Okay? And so we put a plan together to fix that. And so we started off because some of the muscles in his body are really tight. It's a secondary problem to these bones not positioned and not moving. So we had to work on getting the spine and his range of motion improved. So we went through different exercises, different stretches to achieve a higher level of mobility. Then we started doing specific chiropractic adjustments that we do within our CVP technique to get these bones to move that are not moving. But then we also wanted to make sure that we could specifically train small neck muscles to fire in a different pattern so that his body didn't think that this is normal. We had to retrain. It's called neuromuscular reeducation. We had to get the brain to be able to communicate in a way to get these neck muscles to fire in the right sequence so that the head has the ability to pull the head back over top the shoulders. And that way it becomes sustainable. And so we started that process. And 2 months, yes.
Okay. You said she is a registered nurse.
What's that?
Is she a registered nurse?
Yes.
And she got it through the work she did?
Yep. She went through our primary, went through a couple care of action steps of the primary, and then went to physical therapy.
So she got the problem through the work she does?
She got diagnosed with Mayo. Is that what you're saying?
No, through the work. I mean, how did she get it?
Oh, how did Matt get this? Yeah. So, I mean, he's constantly over top of patients like this a lot. Okay? And so if I put my body in this position, we're going to start to have a muscle memory pattern. Okay? Has anybody heard of P90X? That crazy workout program? It's a guy by the name of Tony Horton. And he coined this phrase called muscle confusion. And the workout world, it absolutely flipped the entire workout world upside down. Because what they did for years is if I wanted to get big biceps, I would just do this all day long. But he says there's a point in time to where your body starts to recognize what you're doing. Okay? The same thing applies for our static body positions in our daily life. If we get used, if we're just like this all day long, or for the large majority of the day, our body's going to start to get used to this position, and then soon this position's going to be our common normal position. Okay? It's still not normal, but it's becoming what my new posture is. And so in this position, my chest muscles get tight, my anterior scalene muscles get tight, my shoulders are on forward. All of these muscles on the back are being stretched and pulled so they become weak. They don't have the capacity to come back here. So very, very good question. And so we took another x-ray at the 2-month mark of care. Okay? And this is what we see. He still has 0 forward head posture. The red line's not on there. But the yellow lines, they went from 30.7 degrees to a 40.0. Should be 42, 45 is the average. So we're closer towards 0. Okay? Or we're closer towards the normal degree of curvature, which means there's less tension on the nervous system, which means what should be happening to his symptoms? They're improving. Okay? These numbers here, this 8 and this 14, they should be 18 degrees, both of them. Now we're at 15 and 17. We're closer towards normal. There's less pressure on the cervical or the cervical brainstem up here. We have more communication from our brain to our body. which means our body's healing and functioning better, which means his symptoms should be improving. That's exactly yes.
So when he goes, I mean, he's obviously at this time still working, still doing this. Perhaps he been taught to do something different than that.
He's still working, okay? And that's the reality. I spent 4 years, part of the first 4 years of my practice before we moved here, I spent with 4 USA Olympic teams, okay? Wrestling, weightlifting, martial arts, and judo. And now we're dealing with people who train 3 to 4 times a day, and when they get hurt, they can't stop training, okay? The same thing happens for us. You know, our life just can't be put on pause, okay? Most people don't have that luxury. Like Dr. Vedan said, he answered the question of how do we fix this? Do we just stop using these things? He said the reality is we're not going to stop using them. We got to learn how to manage it. Our body's an intelligent entity. There's so much intelligence, innate intelligence inside of us. Our body's always trying to be in this state of homeostasis, which is normalized function, and we're adapting to our environments. Our body should have the capability to do this all day long without any irritation. The problem is we don't take care of our spine and our nervous system like we do our teeth, like we do our nails, like we do our hair, like we do our car, like we do anything else. And so if we neglect something, it starts to function at a lower level. And so here's where he was at the 2-month mark. I apologize. He went from a 30 to a 40-degree curve. The upper cervical measurements improved. And this is what his post-digital motion analysis was. Everything is functioning. Everything is moving. Structure's improving. Functionality is fixed. So his body better be working better. And that's exactly what he said. He goes, after a couple of treatments, massage therapy, one-time acu, and a couple of various other treatments. That didn't work. I found the solution in our office. They're great. My back and neck pain is almost zero. Okay? So the reality is somebody that was dealing with near debilitating pain no longer has that. It has nothing to do with the miracle that I did. It's just taking pressure off the body so that the body can heal the way it's supposed to. Okay? Same thing for Christina. Christina, 25 years of migraines, 23 years of headaches. Okay? We look here. Picture on the left, much less curve. We're talking about a 2-degree curve. Clearly that's a problem. Okay? So feel the neck muscles in your spine. You're in a neutral position. They're nice and relaxed or more relaxed. Tip your head forward. They become tight. So she dealt with chronic cervicogenic headaches like we talked about at the very beginning. Okay, 23 years of headaches, 25 years of migraines. We did the same analysis. We found 7 subluxations. 3 bones this time are not moving. We did a similar pattern of treatment for her. And here, this was October 12th of 2015. This is January 19th of 2016. So just about 3 months of care, we cleared out all the subluxations. So now the body's functioning better. After suffering migraines for 23 plus years, I finally found relief. Only after a few visits did my headaches and my migraines stop. Okay? The reality is there was an answer for her. She just didn't know what it was. We met her at a Think Bank corporate wellness program that we were invited to. Okay? Casey, is there a problem here? She's got a negative 12-degree curve. It should be a positive 45. That's 57 degrees away from normal. Casey's 24 years old. We're talking about major migraines, okay? We're talking about heart palpitations, hormonal issues. We're dealing with chronic neck pain, okay? And this is where we got her. We went from a negative 12 to a 3.6 in a short period of time. That is 15.5 degrees of improvement. We're not, in this picture, not close towards normal yet. But we're much improved, and so thus the same thing has happened with her symptoms. Almost everything with the neck pain and headaches are gone. Hormone issues and the menstrual cycles have improved, and the digestive functions are better. How in the world can a digestive system issue potentially be correlated to a neck issue? Well, if we go all the way back to what we were taught in biology class, That'll bring us to this chart. Autonomic nervous system. Has anybody ever seen this one before? Okay? The brain controls everything. Different segments and level of the body control different things. And when we look here, this very top part of the brainstem, we have what's called the vagus nerve. It's the parasympathetic division of the nervous system that goes to every internal organ of the body. It controls your resting state function of everything. So when you're not getting chased by a lion or a tiger, you're not getting, you're not getting pulled over by the police for speeding because you go through that sympathetic response. That's the system that's supposed to be controlling it. So if I take here this nerve that goes all the way down to the stomach and digestive system, if I cut that in half, what happens to the digestive function? Stops. You have zero digestion, none. The brain can't control the digestive system and tell that part of the body to function. There's zero relaying signals. What if I took a pliers and I cramped it? So let's just say theoretically 50% loss. We're going to have problems. The same thing happens when this spine is removed from its normal position, or those bones are not functioning. That nerve becomes compromised, and wherever that nerve travels to, we have issues. And so this is where Casey's problem was located, right on top of the brainstem. So whether it's heart beating, lungs breathing, okay, we have the liver up here for detoxification, gallbladder, pancreas for blood sugar levels. We have the spleen for immune functions. We have the stomach, the digestive system, and the intestines there. There's a lot of organ function there. And so the reality is, Christopher Reeves is a great example of what can happen if we truly interfere with the nervous system's ability to work. Anybody remember his story? Yeah, he fell off a horse named Buck. No pun intended. Okay, truly, read the story. His head and jaw hit the ground. Okay, the initial theory was that he broke the top bone in his neck, but if you read his autobiography and you look at Dr. Susan Groves, MD, there was no broken bones. It's just that atlas shifted out of position a couple millimeters, which is the top bone of the neck. That put pressure on his brainstem, which immediately shut to the neuromuscular tracts of your spinal cord down. It became a quadriplegic. Okay? But guess what? He didn't die of being a quadriplegic. What did he die from? A common cold and bed sores. A general condition, the common cold that we would all fight off because our immune system's working at a better potential. The nervous system controls the immune system's level to function. Okay? And so that's why she made the comment in his book, spinal cord injuries eventually affect every part of the entire body. And when you damage the spinal cord, it's called accelerated aging. Okay? And that's what happens when we go through these phases of degeneration. Our brain loses the ability to transmit those signals the way they're supposed to be transmitted, so the quality and the functionality of our body starts to suffer and become compromised. Then we get to phase 2. Once we get to phase 2, you and I have a degrees of good conversation. If you're here, I can't get you all the way back to normal because we can't undo the degeneration. We can't undo the osteoarthritis that's there, but we can stop it from progressing any longer, and we can improve the negative damage that's already there. We get to phase 3, our job is to do what we can to stop it from progressing. Because if we get to phase 4, we're dealing with a level of quality of life that's just nobody wants to be at, most likely. And so we get to this position when we see our patients here. We see patients for this all day long. It may not be called text neck for you. We may be dealing with anterior head carriage that's led to phase 2, degenerative disc disease and osteoarthritis that's led to stenosis, leading to numbness and tingling or radiculopathy in the arms, hands, and fingers. But the foundation is the same problem that we call text neck. It's forward head posture. It's anterior head carriage. It's loss of the cervical curve. Okay? What about arthritis? What causes arthritis? Osteoarthritis. Arthur, as some patients call him. You guys know what causes osteoarthritis? Is it age-related? No. Is it a genetic issue? And I'll talk about these two things, so I'm not just going to leave you hanging. Is it a genetic issue? Here's what we see oftentimes, okay? We'll have a patient come in. Doc, is there anything they can do with my knee? Okay, we're dealing with like a 60, 70-year-old patient often with this situation. Is there anything you can do with the knee? I was told I have the old 70-year-old arthritic right knee. How old's your left knee? 70. Why don't you have a problem over here? Okay. If it was genetic, when would we have had the problem? From birth. Okay. If it was an age-related thing, it would have happened in every joint of our body. Wouldn't just be the right knee. Wouldn't just be the right knee and the right hip or the right ankle. Okay. Osteoarthritis occurs from abnormal weight bearing. It's physics. Okay? If I'm in the neutral position, my structure is intact. My bones and joints are moving the way they're supposed to. Now, all of the bones and joints can disperse the stress from gravity and everything that we do throughout our day evenly throughout the joint complex. Meaning we're not putting more stress on one side of the joint than the other, or we're not putting more stress and pressure on one joint than another joint. The difference comes into play when we have something like this. Okay? If I walked like this all day long, left side versus right side, which side is going to wear out first? The right side, because I'm putting more physical weight and stress on it. What happens is when we shift where we're carrying our weight and we increase the load on a joint greater than it's supposed to have, it wears out. And then our body goes through this level of what's called Wolff's Law. It actually creates additional bone growth to help support that area, to help stabilize it so that it doesn't become weak. But we see that on an x-ray as osteoarthritis. And so when we see people coming in to the office for multiple conditions, which can all be just like Tex neck, no different than Judy. Okay? She's now having less low back pain, less neck pain, and sciatica. Same thing with Dave. I think Dave is 68 years old, and he rides his bicycle 6 miles a day. And his goal was to get rid of shoulder and hip pain. No, doesn't have any pain anymore. Okay? Sam, scoliosis, neck and hip pain and sciatica, gone. Andrea works at the hospital here. No longer has the hip pain and sciatica. She's a runner. Okay? Corey, we met her because she worked at Quick Trip. She had a work comp injury. Came into the office, massive neck pain and headaches and shoulder pain. Lifting a big box of milk crate above here and just gave out. Okay? Lisa, this is the foundation of what we do. Okay? I'll end on this, and then I'll open up for some questions here. Our job as a doctor, whatever your level of doctoring and doctorate is, doctor means teacher. And our job as physicians, our job as health leaders, our job as individuals in the health field is to help educate you on what it takes, steps that you need to do to help improve your quality of life. Dr. Pratt and his staff have changed our lives. She's the mother of Casey, the x-ray that we showed not too long ago, with the care and the information we get. She came in with neck pain and headaches, had Tex neck-like problems. Okay? She doesn't have that anymore. And she's still a patient 4.5 years later in maintenance care because she chooses to. She attends our workshops. In fact, we just had one a month ago where we had 57 people go through a free 30-day nutritional plan and weight loss program. She participated in it. She lost 15 pounds, has more energy. She chooses to do the things that we educate our patients on, and it gets to the point to where she's experienced a higher level of health and functionality for her, her husband Mark, their oldest daughter Casey, and the rest of their kids. And she gets to the position to where health is no longer how we feel, it's how we function. And they don't spend as much money on health problems anymore. They're not taking as much medication. They're sleeping better. They don't have as much pain. The activities that they can do are to a greater degree, which means they can enjoy their time more. That's the bigness of what we do. If we can give you a bit of information so that you can ultimately turn that into an action step, and it can better yourself and your health in any level or any perspective, whether it's stuff like the 30-day challenge we just got done. Patient spends $0 in the office. You don't have to be a patient to do. We make no money off of, but I want to see you guys lose weight because that means you have less stress on your joints. Less stress on your joints means my job, if you're a patient in my office, becomes easier. Okay? Less stress on your joints and less weight means you have less metabolic problems, more hormone regulation. Obesity and overweight can lead to many different problems. Your rates of heart disease, your rates of cancer decline. But more than that, it brings a smile to your face. It brings a joy to your life and an ease to your life. That's the joy that we have here. We get to see families change. We get to see life being brought back in individuals. Okay? One of my first 5 patients moving here, Vernell, 76, 75 years old, oxygen tank, cane, drug in by her daughters into our office like this. Can't go a couple of minutes without her oxygen tank, 100% dependent. Got to the point to where she thought about committing suicide numerous times because the quality of life was so far less than what she ever thought she would be at. Life was not worth living for her in moments of her life. Brought in, did not want to do anything. Family made her. We started going through the same things that we're teaching here. She started applying the nutritional programs and the things that we teach in the office. She started getting better, losing weight. She started needing her oxygen tank not as much. She could take breaks. And then we started to get her at 75, 76 years old, started to get her to exercise a little bit. Oh my goodness. You'd have thought it was the end of the world. Okay? But seeing her at the office on Saturday mornings when we held our free workout classes, we had about 20-some people working out. She wasn't doing what other people were, but she was being active. She was trying. And her body knows. She watched her exposure to toxicity. She eliminating the bad stuff as much as she could. In a couple months, she got off of a respirator. She only needed a CPAP at night. How big was that for her? She's no longer tied to something all day long. She can now be mobile. She can now be free. She's driving herself. Husband still doesn't want to partake in anything. But she continued. She lost over 50-some pounds off of all medications, not even on a CPAP anymore. And you would think she is literally like 20 years younger. That was one of my first 5 patients in my office. I will never forget that because my job is not necessarily just getting you out of pain. It's helping you realize that you have a potential inside of you that's far greater than you give yourself credit for, that you think you have. The body is limitless. When we give it the ability to improve, it does just that. And oftentimes it goes above and beyond what we could have imagined for ourselves. And so if there's anything I can leave with you guys tonight, it's a level of hope. It's a level of hope that your body can improve. To what degree? Who knows? An exam can tell to a degree, but our body is infinitely intelligent. And if you give it a chance, I believe you'll be surprised with the outcomes and you will not be disappointed. Okay? So I thank you guys for having me here tonight. I appreciate the hour. Most of the time I go late. I tried not to have a clock back there. But you guys are amazing people. It's been an honor to stand in front of you guys. And if you have any questions, I'll be at the back. If you'd like to know what an examination is like, there's a card in the back. Just call our office, and we'll do everything we can to help you. Just let us know if there's anything we need help. So appreciate you guys.